I think we really need to ban firearms and specifically handguns and assault weapons. I think this is a public health issue.
That's the message echoed by frontline health workers across the country today. A national day of action with rallies in 13 cities from Halifax to Vancouver. The group, Doctors for Protection from Guns, was created after last summer's Danforth shooting in Toronto. They say they are speaking out to prevent more shootings.
We see the realities of gun violence on an almost weekly basis. These are not rare events. These are not events that are occurring in other countries, in other cities. They're happening here. Canada
has seen a 42% increase in gun-related violence since 2013. So one of the ways that they are calling for change is through Bill C-71. The proposed legislation would overhaul the background check system, create new record-keeping requirements for retailers, and increase the restrictions around transporting guns. The bill is still being debated in committee in the Senate. Some oppose those changes, though, saying that they target legal gun owners. The Canadian Coalition for Firearms Rights also says the doctors are wrong to present themselves as policy experts. Comments similar to the NRA, which said doctors in the U.S. should just stay in their lane. So we asked doctors about their experience treating gunshot wounds and why they are making this their cause.
Weapons of war have no place in our civil society.
Reese Fallon was killed, 2 other friends were shot, and down the street 10 others were injured.
My innocent younger brother was shot 12 times in his car 2 minutes from my home.
Canada's death rate for firearms is 3 times that of Ireland, Spain, and the Netherlands. We can do better.
We witness firsthand the devastation that these bullets wrought. We see how these bullets tear apart flesh and tear apart the tissues and tear apart the organs, robbing the person of their lives. We witness what this does to the families and the lifelong result of these injuries. They never are really the same.
I remember vividly a woman who was on her knees pleading for mercy when her husband shot her. She was shot through the heart, the lungs, the stomach, the spleen, the pancreas, the colon, the kidney. She was in the operating room for hours and then required multiple surgeries after that. She was hospitalized in the ICU in the hospital for weeks. She eventually survived. She had a bowel bag. I'm sure her life was never the same.
This was during my training in the United States, in Los Angeles, where it was a routine event to have people coming in with gunshot injuries, largely related to gang violence, but sometimes just other random events. This was extremely traumatic, not only to the patient, but their family, and of course caused a major disruption in healthcare because of all the services required to take care of these people.
This person suffered from post-traumatic stress disorder, was never able to return to work. Their family was affected by it, being in the hospital for months and months, and then suffering emotional trauma for years and years afterwards.
I became a doctor so I could stand up and say, enough is enough.
I'm here today and I'm in my lane.
This is our lane. Our lane involves caring for people who are victims of gun injuries and preventing those injuries, because that is part of the role of being a healthcare worker.
We know that 75% of firearm deaths in Canada is actually death by suicide. So if this isn't my lane to help, I really don't know whose lane it is.
We feel that we have an obligation not just to treat patients, but to treat gunshot wounds like any disease and advocate for preventive measures.
We don't have any problem with hunters or hunting weapons or things like that, but assault weapons really have no useful purpose in a civilized society.
It's our lane because we've held the hand of a mother who's lost their son. We have consoled a husband who has lost his wife. We have broken the terrible news that a loved one has passed away. We see the devastation, and it's time for us to speak on behalf of our patients.